see, we're almost ready.
You are important to me.
Thank you. Well, you're important to our community, and my community is important to me. And thank you guys so much for watching Chef AJ Live. I'm Chef AJ, your host, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Well, for those of you that watch me regularly or subscribe to my mailing list, you know that January 1st, we started a new format. We have 28 regular shows on Chef AJ Live. Today is the first Thursday of the month, so you can look forward to dermatologist Jessica Krant, who is going to be talking about healthy skin and glowing from within. She's been on the show before. She is one of our most popular guests, and therefore you have to submit your questions in advance. You know, of the 28 shows that we have now on Chef AJ Live, 18 of them are doctors, so we can no longer accept questions from the chat. It's just not possible. The show is multi-streaming to like 7 different places. My chat blows up with all these comments. You have to send it in. It's a very easy process. Simply subscribe to my mailing list. I'll put a link below. Every Saturday, we send you an email with the lineup that's coming up the next week. All you have to do is respond to that email. Please keep in mind, we can only accept 1 question per email address, and it has to be fairly short. Otherwise, you need to get a consult. I haven't seen her in about 4 months. I'm so excited to start the new year with the plant-based dermatologist, Dr. Jessica Krant. Always good to see you.
Always so special to be here with you and your audience, Chef AJ.
I gotta say, yeah, I mean, obviously you're wonderful. You're very intelligent. You have a great personality, but I think there's something about the specialty of dermatology because everybody's got skin, right? I mean, everybody's got everything, but you know, like not everybody has a prostate. And the thing is it's just it seems like it's one of the most popular topics because it's the largest organ in the body. So there's so much potential to have something wrong because when you're on, you and Dr. Lyle, we get more questions than any other doctors.
You know, not only is skin the largest organ, it also is a true mirror of what is going on inside us, and it is how the world. So if anyone's aware of anything at all, health-wise, it will always be something on the skin because we're so conscious of how we appear to other people, and it affects, you know, our, like you said, Dr. Lyle, like our psyche, our mental health, our emotional health, both medically and you know, emotionally, depending on what's going on with our skin. So you're right. It hits all of us.
You know, and absolutely. And the thing is we all can see our skin. Whereas if we have something wrong with our liver, we can't see it. But when something goes wrong on our skin, we know.
We know, and we're very sensitive to it. So, you know, I always tell my patients, my favorite type of office visit, if somebody would come in with something they're worried about, they feel shy about asking because they feel like, well, maybe it's nothing. I don't want to bother the doctor. And I say, I love for you to come in, show me something you're not sure about, and let me tell you it's okay. There's no lower end barrier for me. I would love, you know, anyone to come in with any question. My favorite news is there's nothing wrong. Everything's okay. So I like to answer all questions. You know, people tease me because when I go to parties, everyone has skin and they'll say, oh, you're a dermatologist? While I'm here, can you just either look at this spot or what's the best anti-aging cream? And other people next to me might say, oh my gosh, I can't believe you're bothering her at a party. And I say, I love it because, you know, I don't want a barrier between anyone asking questions and me being able to reassure and help. And in that setting, it's very easy to either say, don't worry, or maybe we should look more, come into the office. I never mind. I'm grateful to have the privilege of this career and to be able to help people. So it never bothers me.
Well, if I had known that when we were at that conference together, I would have showed you a few things. Maybe we'll end up at a party together. So, man, if you were in my city, you would definitely be my dermatologist. That is it. You know, it's interesting in your profession, like a lot of professions, especially like GI, you know, or other professions, they got to do a lot of tests, X-rays, MRIs, CAT scans, where you can just see what's wrong.
Well, that's one of the reasons, honestly, that I ended up choosing dermatology. I really loved everything in medical school. I was originally aiming to be an orthopedic surgeon, and then I was really interested in pathology in radiology, and I realized that it was the visual imagery. I've always been very visual. I was an art and design major in college. So I've always been extremely visual, but also interested in emotional health and psychology and psychiatry, and also in surgery and hands-on. I always was building things and creating things when I was growing up. So it turns out that dermatology is a combination of hands-on surgical and procedural with the cosmetic procedures and with skin cancer surgery. It's very emotionally and psychologically related, as we talked about. Both our mental health affects our skin health, but also our skin health affects our mental health. And also it's a big diagnostic puzzle, and I really appreciate the old-fashioned classic, as you say. I take a history, I can literally look with my own eyeballs and feel with my hands, which are wearing gloves, on a physical exam. And if I know what I'm doing and I have a lot of experience, I might be able to tell most of the story without having to do any tests. That's really a wonder of dermatology. It's very old-fashioned in that way. We do have biopsies and we do sometimes do some testing, but I feel like people sort of tease dermatologists about not being more serious doctors, but in a way, we're almost the classic old-fashioned doctor, because we can, without these extremely expensive, fancy, modern testing, often figure out what's wrong with somebody inside just by looking at the skin, the nails, the hair. They really tell a story that's real. And, the best among us, and I wouldn't necessarily say that's me, but the best among us are brilliant, brilliant diagnosticians, and, sometimes come to the bedside and dermatologists are the ones who figure out what's wrong with somebody inside. So it's true.
That's so cool. Well, it sounds like you found the perfect profession for you. I mean, the perfect specialty of medicine.
I really love it because I wanted something where I could treat men and women and adults and kids. And I thought of ophthalmology, but I thought, well, that's only the eyeball. That's such a small area. I love dermatology because it's literally scalp to toes. It's hair, nails, and skin. It's the whole body, and it's everybody. And it's surgical, and it's medical, it's diagnostic. It's also very high technology with lasers and with devices. And it's immunology. The immune system now in the skin is such a well-known, well-studied topic. And stem cells from skin are being reverse engineered and then being used to create treatments for other medical conditions. So it's like really covers the gamut of high tech in medicine, but also the very low tech, basic, old-fashioned physical exam.
When in medical school do you have to declare what your specialty is going to be? Because I imagine some medical students come in thinking they want one specialty, but then when they actually do the rotation, they realize maybe they want another.
Well, I was the classic. I thought I might be coming in as one thing because someone I idolized very much, my dad, was always a beloved orthopedic surgeon in our community. And I really love surgery and I love the mechanics of how our bodies work. So I thought I might go into orthopedics, but I'm the classic story of every time I did a rotation or a class and I learned about that topic, I thought, well, maybe I want to go into this field because it's so fascinating. And I really loved every field. It's changed a little bit now, but in the first 2 years of medical school, we usually take all of the classwork, the classroom classes, the basic classes of healthy bodies, and then what happens when things start to go wrong. And then third year, when I was in medical school, third year was all of the required standardized rotations in the hospital, where you follow the interns and residents and you're in the hospital learning about the conditions and diseases and treatments month after month after month. Fourth year was always traditionally reserved for the electives, where you would start to choose specialties you want to spend more time in and consider possibly applying to get into for residency training in that field. I think they've put some electives sooner now because it's very hard to wait till the very end to decide and then you're also applying at the same time. So you basically have to decide your field during the end, third and fourth year of medical school, because you apply for 3 to 7 years of residency and fellowship training after medical school in your field.
Wow, interesting. Hey, you ready to get some questions answered for our viewers?
Let's do it.
Absolutely.
Oh, I want to make one pledge for you, Chef AJ, this year for your special new show format, which is that I'm going to try my best. If somebody asks a question and I don't know the answer off the top of my head today in the live show, I will do my best to go research that answer and bring it to your audience next month on our next episode.
Wow, that's fabulous. Thank you. You know, one of the live viewers, Heidi, says she loves you and wish you did telemedicine. You kind of almost could, because you could show things on Zoom.
Right. Sometimes in dermatology, we can do an effective telemedicine visit. And for some things, it really does have to be in person. Right now, I'm only licensed to practice dermatology in the state of New York. So I could only do telemedicine in New York for people who are in New York right now. One day that might change. So everybody keep in touch. But yeah, unfortunately, I don't have an easy way to do it right now. But thank you, Heidi. I'm very flattered.
Great. All right. So we always ask the questions in order they are received. So please get them into us as soon as possible, because we might have too many for today's show. The first one is from Amanda, and she says, I'm 33. I've been vegan for 3.5 years, mostly whole foods. There's a noticeable amount of fat loss in the skin around my eyes, mainly my upper eyelids. There are also darker circles under my eyes. I understand that skin loses elasticity and collagen throughout the years. However, it's a bit worrisome to me, and I want to know if there's any specific vitamins or minerals that would be a good idea to get tested, such as iron, vitamin K, zinc, copper, vitamin E. I learned recently through the organic acid test and I'm low in vitamin C, even though I eat vitamin C rich foods. I've seen multiple dermatologists along with my PCP, and I'm a bit stuck. Thank you.
This one might be a little tricky to answer without seeing you, but I wanted to say that, you know, when we do become plant-based and vegan, I became 100% plant-based coming up on 4 years ago now. I'll never catch up with Chef AJ, but I can't believe it's been 4 years. And I do know, you know, we lose fat when we change this lifestyle. And I think genetically, it's possible that we lose fat also around the bone structure of the face. So I don't know how much is genetic, how much is natural aging, where women do kind of get a little more hollowed out around the eyes and the temples over time, and how much might be just from lifestyle and diet. I don't know how much fat you have in your diet and what mix of healthy fats there are. I don't know if you're eating avocados and nuts and seeds. But if you feel like there's a loss of elasticity and something different about the quality of your skin, especially noticeable potentially in your face, you could potentially have a biopsy done and have some genetic testing on the collagen, or have the collagen examined and the elastin fibers examined to make sure there's nothing wrong. I don't know about the organic acid test, or whether it's true or not that you're low in vitamin C or ascorbic acid. That's more complicated than I could really answer right here. But I do agree that you might as well keep looking into it. Some of it could be genetic, and it is a complicated thing to figure out. But I can see that, I would say just keep investigating.
Great. Thank you. The next question is from Joyce. How do I get rid of puffy under eye bags? I eat whole food plant-based with minimal salt, drink 60 ounces of water a day, try to get 7 hours of sleep at night, and exercise daily. My mother has the same issues, but my 3 sisters don't.
And it's interesting, that's 2 eyelid questions back to back. Unfortunately, physical puffiness of the bag right under the eye, where the bag pooches outward, is generally a natural anatomical fat pad that does belong there, but it can escape its area where it's usually tucked in under the orbital bone, under the eye, and it can come out a little bit. Unfortunately, it's pretty genetic. And really the only way to address it for sure would be oculoplastic surgery or eyelid surgery with a very qualified plastic surgeon or dermatologic surgeon who has a lot of experience with eyelids. In the old days, in the 80s, 1980s, they used to suck out the little fat pad and take the fat out. And it turned out that was a bad idea because everybody looked too hollowed out and didn't have the natural juiciness under there and the support. So we learned not to do that. But sometimes the eye bags do come forward, and there's nothing really vitamin wise or skin tightening that's really going to permanently fix that without surgery.
Darn. Okay. Well, thank you. This is from Mageda. I hope I pronounced your name wrong. I love the new monthly schedule for your show. It's going to be great. Thank you. I have a question for Dr. Grant. Can you please ask her what is her favorite tool for gentle facial exfoliation?
Fingertips. I'm not a huge proponent of physical mechanical exfoliation. I don't mind a little bit of a soft sugar scrub or something with very fine particles gently being massaged into the face, but I don't believe in aggressive mechanical rubbing because I believe it triggers inflammation, which actually leads to aging of the cells. And when we over exfoliate, we're just irritating our skin, where our skin reads it as injury, and it starts overproducing skin cells to try to build up a defensive barrier to protect itself from that continuing to happen. So you become somebody who is exfoliating and feeling like you have to exfoliate more and more over time because everything is so dry and flaky. So I would actually recommend backing off on that, doing more gentle moisturizing, potentially creating chemical exfoliation with a retinoid, which if you want to be 100% plant-based, could be the molecule bakuchiol, which is a newer plant-based cousin of retinoids. And, other things like gentle glycolic acid or gentle beta hydroxy acid peels, which is salicylic acid. Those take-home peel pads, or have your dermatologist or your facialist do a gentle chemical peel, something like that.
Cool, thanks. Here's a question from, no name. Okay. Oh, Melanie, excuse me. For healthy skin, should vitamin C serum, hyaluronic acid, and facial oil be used? If so, is it better to buy an all-in-one product or use them separately? That's a good question.
I think the all-in-one versus separate part of the question is hard to answer because it really depends on the quality of the products, and it depends on your ability to stick to the routine. For a combination product, I don't really know what's in it. So I can't tell you, yes, it's better to get a combination product because it may be that the ingredients are not well formed and don't work together. So it's always safer to buy separate high quality products if you are able to stick to the routine of doing them. Vitamin C, topical vitamin C is proven antioxidant. So it protects the skin from damage from the environment and from sun. And it also is a little bit exfoliating and a little bit brightening. Vitamin C is, I would say, one of the top 2 or 3 products that you would want if you're starting to create your list of your hierarchy of your list. Hyaluronic acid it comes in a lot of different types of molecules of hyaluronic acid, hyaluronate, but mostly it's a type of a moisturizer that also is a little bit activating for the skin in terms of metabolism. It also helps absorb other products. If you put a little thin layer of hyaluronic acid serum or moisturizer on, and then another product right on top, the hyaluronic acid product, depending on the formula, can make your skin surface a little more transparent and help the other molecule go through better. if that's an irritating molecule, you have to watch out for that because you might create more irritation. So you play around with it. But either way, hyaluronic acid itself is pretty gentle and inert in that it's not actively doing very much to change your skin, but it's light, moisturizing, and very popular these days. The facial oil, I don't know the answer because it really depends on what's in the oil. If it works for you as a light moisturizer or potentially an oil cleanser to help take makeup off, I'm fine with that. But I don't have a strong feeling about whether it's important for healthy skin or anti-aging.
Right. I mean, sometimes there's so many different products, and I've had people that sell vegan skincare on and high quality products, but they make it seem like you need like a million different things. You got to use the cleanser and the moisturizer and the tone. I mean, it could take all day.
Well, I don't want to embarrass myself too much and say that so far you could not find me in the bathroom that long to be able to do all that. I just don't have the self-discipline. So for me, I go for the simplest possible. I say, wash your face if it's dirty, remove your makeup gently, make sure you rinse and get chemicals off if you're removing makeup. If you want to do one anti-aging product, it really should be a moisturizer with sunscreen built in for daytime. Second anti-aging product would be a retinoid, which is a derivative of vitamin A. And over the counter, it's retinol. And in prescription products, it has some different options. But bakuchiol is the plant-based alternative option to that right now. That's number 2. And I guess number 3 would be like a vitamin C serum for the morning. Retinoid at night, sunscreen, moisturizer in the morning with potentially with some vitamin C. Those are the basics. The other serums and peels and exfoliating, that's all extra because a lot of the things that we want to happen will happen with just the retinoid and the vitamin C and with the sunscreen protecting us from continually adding damage while we claim we're trying to reverse it.
Wow. Is a lot of our skin just genetic? I mean, obviously, smoking, eating poorly, sun damage can affect it, but is a lot of skin quality just, genetic?
Absolutely. The baseline of what we get is genetic and very hormonally sensitive and sensitive to, not only genetics, but my favorite subject, which is epigenetics, which is not only the genes that are in the actual DNA, but how our lifestyle, our environment, our choices about what we eat and how we sleep are actually creating chemical signals in our body that switch on and off certain genes that actually change what it looks like our genetics are, but it's really how our genes are choosing to behave based on how we're behaving. So it's genetics, it's epigenetics, which is lifestyle and behavior and choices. And then it's external factors.
You mentioned wash your skin if it's dirty. I've had Dr. Robert Chutkin, who wrote Gut Bliss on a few times, and she talked about we shouldn't be washing our hair every day. So is it still a good idea to wash our skin every day, or is it better to leave it dirty sometimes?
This is very hard to answer because it is also genetically related. I hear things coming in from Instagram in my office. People, come in with habits that they learn online on social media. And I always say, look, let's make sure you're just doing what's best for you, because each individual person, their skin tolerates cleansing better or worse, or needs to be washed a little more often or less often. Same with hair. Hair and scalp are also different and not necessarily wanting the same treatment. So we have to balance the shampooing, the conditioning, and all those other factors along with it too. I can recommend for some people to wash and cleanse less often because they're just irritating and drying out their skin, their hair, and their scalp. But some people may benefit from a little more cleansing because the idea behind not washing as much is to allow our skin's natural microbiome, microbes, bacteria, viruses, and fungi to balance in the skin so they balance each other out and don't create rashes and inflammation. But also sometimes we need to help remove excess dead skin cells and a little bit of oil to help keep everything fresh and turn over new cells. So there's no one answer to that. And I could just talk about it for another 20 minutes, but I really decide based on what's happening to my patient's skin and their scalp and their hair individually. And sometimes it goes one way and sometimes it goes the other.
I remember when I interviewed you for the GI Health Summit, you talked about how skin has its own microbiome, just kind of like the gut does.
Yeah, that's really my core favorite topic, which is that everyone's getting familiar with the fact that what we eat really controls the balance of the microbiome in our gut, and the microbiome controls us. It controls our behavior. It controls our mental health. It controls what all the chemical signals that go through our bodies. And skin also responds to the gut microbiome, but skin also has its own balance of healthy, natural mix of bacteria and other microbes. And when it gets unbalanced and bad actors become more prominent, it creates inflammation, irritation, and infections. So one of the most fascinating things I've learned about the skin microbiome is that it's more diverse among humans than the gut microbiome. It's more common for people to have more similar gut microbiomes depending on where you live, but each individual person has almost a skin microbiome like fingerprint. It's not finger, but where it's very hard for them to study skin microbiomes because everyone's literally different individually, like a fingerprint. And when they try to alter the skin microbiome, for example, with skin products that you put on the skin that affect the microbiome, the person will automatically want to try to revert to their own natural genetic microbiome if they ever stop those products. We just have a genetic, natural environment on each individual person. So it makes it hard to use that microbiome to make products, but it's important to think about it when talking about not overwashing or not over irritating.
Great, thanks. Evelyn wants to know if you're going to write a book.
Oh, sure. I'm definitely going to write a book. I want to know next time what book people want me to write, because I have so many different book ideas, but I definitely would love to write a book in the next year or two, maybe more than one.
That's fantastic. I cannot wait. We'll promote it on the show. Here's a question from Daria, and she says that she's a nurse and has a number of diabetic patients that have eczema and fungal infections. And it seems like the doctors only prescribe oral medications or steroid creams. I wanted to ask Dr. Krant about the best way to treat eczema and fungal infections without oral medications or steroids.
Well, eczema is not an infection. So eczema is a condition of a damaged skin barrier that is so damaged it's unable to seal itself back up, moisturize itself, and rebalance. So for eczema, if it's just plain eczema from being too dry in certain areas or over cleansed, the number one is reduce the things that are stripping the natural oils away from the skin and seal up the area that has the eczema patch from exposure to air, soap, and water. Let the skin get a chance to come from the inside and bring healing and reseal back up. It can't do it when the skin is broken, dry, red, and itchy, because our natural transepidermal water loss, which should be controlled by an intact skin barrier, with eczema, the water is lost so quickly through evaporation through the skin can't hold on to it and use it to start healing. So artificial barrier, like very emollient, almost greasy moisturizers, and avoiding irritants, avoiding soap, water, and air, avoiding known allergens against the skin. And then if if needed for the feeling of itchiness, that's when a topical steroid can be temporarily valuable, because if somebody's scratching, they're continually breaking the barrier and it can't heal. So steroids are good for the feeling of itchiness. The cream or ointment base that they come in is really getting used as a barrier. So you could get a different barrier that doesn't have the medicine in it and go from there. There's a wide spectrum of things that are called eczema. Some of them are healable with just basic healthier skincare, and some need a little more intervention if they're really coming from internal. Could be from an unidentified dietary allergy or environmental exposure. So that's not basic eczema. That would be like allergic eczema and needs more investigation. Fungal infections are true infections with actual fungal microbes. You can't necessarily moisturize a fungus away. However, if you make the barrier of the skin healthier, it allows the body to do more to heal and to potentially fight the infection, maybe fight it off. On the skin, we really need some antifungal treatments. Tea tree oil is a known antiseptic, antimicrobial. When it's very strong formula, it can actually burn the skin and be too strong. So if you dilute it, it may help. It may not be antifungal specific enough to actually get rid of a true fungal infection. So that may need some topical antifungal prescription medicines or over-the-counter antifungals like athlete's foot creams. But if you're talking about nails, which I suspect you may be, nails are very stubborn, and that is a true, deep internal, rooted, no pun intended, infection. Very hard to fully get rid of without oral antifungal medication, but some people try with topicals. It's can be tricky. I don't believe that the laser treatments have really panned out to be as effective as we hoped. So I don't know of a nail fungus treatment that's not a pill that is very reliable right now.
Okay, thanks. Here's a question from Karen. Have you heard of the brand? It's dermatology, but there's no vowels. DRMTLGY skincare. And if so, what are your thoughts?
I have heard of the brand. I recognize the name. I don't have thoughts about it. I don't know what's in it, but I know a lot of the newer, very thoughtfully designed skincare lines are vegan, they're cruelty-free, they're gentle, they're basic. I don't have anything negative to say about it, but I don't really know how to give you a recommendation on it. And don't know if those qualities apply to that one, but I know many lines do have all those qualities right now.
I Googled it. It says medical grade skincare. I've not heard of it. And she has a second question. What do you think of red light therapy for the face and neck? And maybe you can explain what that is.
A lot of people are familiar with laser technology, which is when we use a beam of light that could be different wavelengths, which means different colors. But if we remembered back to like junior high or high school physics, a true laser has all one wavelength of light, which means one single color. And the beam is organized into what they call collimated, which means it makes a single column and all the wavelengths go together. So it's very strong and very specific. It doesn't, a regular light bulb light, the light spreads out and gets weaker as we go. A lot of lasers are also invisible to the eye. They're in the spectrum where we can't see them with our naked eye, but they do either damage or help the skin depending on how we use them. These other therapies, the blue light, the red light, the green light, they are generally created now by LED bulbs. I forgot what those are called, light emission diode. I think they're in a lot of devices now. And we have some research that red light and blue light especially do help the skin. Either they're anti-inflammatory or they may activate porphyrins, which are deep in the cells, which help to kill inflammation. And these lights can also potentially help acne. So in certain devices and controlled settings, especially in your dermatologist's office, I trust that they can be helpful. A lot of people are selling home devices home masks and home handheld lights. I don't know if they do enough. I don't know if they're so strong that they're actually dangerous. I do know that one company had their red light mask recalled for risk of damage to eyesight. So I don't know whether the one you're thinking about is a good idea, but I do know that the technology has some evidence behind it.
Great. Well, here's a question from Janet about a bunch of different treatments that I haven't heard about. So feel free to talk about some or all. And she says, are charcoal facials, fibroblasts, red light therapy, which you just talked about, microcurrent and deep heat radio frequency treatments like profound, healthy options to get rid of wrinkles?
I don't know about the fibroblast treatment because that is cells. I presume they're taking your own cells, but I'm not sure. Those are the fibroblasts are the cells in our own skin that when they are stretched or when they are damaged, those are the cells that signal there's been an injury or some trauma, and they start to trigger new collagen formation. The fibroblasts make the collagen. That's why they're called fibro. It's like fibrous. So the fibroblast therapy may be that they're actually crushing up fibroblasts and giving the growth factors into the skin. I don't know that adding those growth factors makes a difference in the long run. I don't know that it's necessarily safe, and I can't really give a full endorsement of that one. I'm always nervous about things that are biologically active, that are cells, because we have to be careful what we're asking for our skin to do. And sometimes you can't take it back. For example, fat transfer, surgical fat transfer, when plastic surgeons do that, it can come out with a lovely result that can be long lasting, and you don't have to keep going back to your dermatologist for fillers. But if it goes wrong, it's permanent, and then you can really be disfigured. So I always say with the biological treatments, stem cells, fibroblasts, let's be a little cautious. Red light therapy, we talked about. Deep heat, either through a microneedling device that delivers radio frequency energy or radio frequency energy through the skin. That is powerful energy, and it can either be very gentle and do almost nothing, or it can be exaggerated and create the heat that it is trying to deliver too much. And it could create damage to the tissue and permanent scarring, permanent indentations. It may tighten the collagen. It does it by damaging it with heat. It damages the collagen, so your cells feel damaged and trigger healing. Some people are very experienced with the technologies and do them well. And I've heard that some people are very happy with the results of the profound. But I think there's a very narrow window of getting what you want out of it, and it actually does something, and also risk of getting hurt. I also don't think the treatments are inexpensive. So be careful who you go see. Make sure it's a very experienced, board certified physician. Probably a dermatologist, maybe a plastic surgeon, and that you ask them all the questions you want to ask and never feel pushed into doing something you're not sure about.
Thanks. One of the viewers gave a great suggestion. Deborah said, I would like her to write a practical guide to skincare from the top of your head to the bottom of your feet. It's a great suggestion.
All right. I love that idea. That sounds like a good, no pun intended, but like a handbook. And we could just go chapter by chapter down the body.
Yep. There's a question that was also sent in about combating hair loss, PRP, and ultrasonic pulses via TED+. This person's really up on all the technology.
PRP is platelet-rich plasma. They draw your own blood from your arm and they spin it and they take out the platelets in the plasma. They don't include red blood cells. They take the red blood cells out. And they use the other part of the blood, which has a lot of growth factors. Some people inject it with microneedling, and some people use a larger needle. There are proponents who believe it really helps. And there are some people who believe that it doesn't actually do anything different to use the growth factors, but it's the injury of the skin. The poking with the needles that actually is what's triggering fresh wound healing and new creation of growth and cells. Even among experts who do PRP treatments for hair loss commonly, a lot say some people respond very well and other people really don't respond at all. And it's a toss-up, and you basically have to try it and see how it works for you. So I don't know if in the future we will be able to get a more reliable method that definitely works for everybody and is long lasting. But right now, I believe that people who are getting benefit from it are probably also doing 2, 3, or 4 other modalities of treatments at the same time, maybe an oral medication, maybe a serum, and also changing how they take care of their hair. Checking for autoimmune illnesses and other chronic stressors that can cause hair loss, and also doing the PRP as an adjunct to kind of boost the hair growth along. And potentially when they stop doing the PRP treatment, sometimes the hair growth may fall back. So I don't want anyone to be, relying on it too much as a definite savior.
Thanks. Is this mostly an American thing, this obsession with getting rid of wrinkles and looking younger? Because I recently interviewed Dan Buettner, from the Blue Zones, and the people in his book in the hundreds, they don't seem to be obsessed with having all these procedures and potions.
It's definitely not only American. There are certain other countries around the world who do a lot of treatments like this. But I think that it's very interesting to think about the Blue Zones and the cultures where people are over 100 and really don't care about this. Maybe there's a connection between being happy with ourselves in our skin and being completely focused on totally different aspects of life that enrich us from within, which is, one of my other favorite topics, and that keeps us looking young and glowing. If you see a 100-year-old woman and she just has a bright smile and is alert and engaged in life and happy and having a good time and teasing her friends, you think she's beautiful. Nobody would say she's not. So our definition of beautiful and looking young and feeling young, it's very subjective.
Yeah, interesting. Okay. Believe it or not, I think we got to the previous submitted one. So I will now look in the chat. This is a very rare thing, guys. So don't get spoiled, because really we've got to get those questions in. And let's see, I'll take them in the order submitted. The thing is sometimes my chat disappears because I'm going so many places. So let's see. Nancy's saying she's had under-eye circles more like a groove than dark since her teens. Her mom was the same, tried a variety of things over the year without surgery, nothing worked. That does seem to be a common problem, though, is circles under the eyes for people.
Right. We talked earlier about bags puffing out, but hollowed out circles that are a little bit dark under the eyes, it's extremely genetic. And, so far, at least 2 people have said my mom had the same thing. My dad has, bags under his eyes. I know that could be coming for me. It's just anatomical, it's genetic. The dark circles, we can sometimes help because one of the things that makes it look a little dark is that skin there is very thin, and underneath are blood vessels and some circulation. So sometimes a little bit of filler in the area very carefully with a very experienced person can help to lift the skin surface away from those vessels and just change the angle of how the light hits us and make the area have more reflectance and look a little bit brighter. It can make a difference.
Nice. Thank you. Here's Gina saying that when she puts on foundation, all she sees is pores. And does anyone else have the same problem? So minimizing pores, I guess, is what the question is. How do we minimize pores?
Pores are very genetic and very hormonally related. It may be that that's just the genetic family background, or it may be that testosterone and androgens, the sort of more male hormones, may be a little elevated, relating to the estrogen and no more female hormones. It depends. Some people with larger pores that are not genetically natural to them may have other issues like acne or things like that, could be at risk for potentially being diagnosed with polycystic ovarian syndrome if that has never been examined. But to shrink the pores, maybe hormonal treatment like a birth control pill could change the balance. Maybe some lasers can temporarily shrink the appearance of pores, and also topical treatments like retinoids, those vitamin A derivatives. Retinol it helps to shrink the oil glands, the sebaceous glands that are under those pores and the pore is the opening of that gland. So shrinking the gland may shrink the openings and the ducts, which are the pores, and may shrink the appearance of the pores on the surface. None of that is really permanent. If it's a genetic tendency, it will always revert back even after all of those treatments once they stop.
Thank you. Let's see. Lynn says, I'm vegan and mostly raw. I use coconut oil with rosemary or lavender. Is that good for healing and moisture, treating the scalp 1 time a week for hair loss? You know, we had Dr. Furman on recently, and he had a question about hair loss, especially when people change their diet. And he talked about something I had never heard called telogen effluvium. Are you familiar with that?
Yes. Telogen effluvium is what made the New York Times, like, I think almost front page during the pandemic. Telogen effluvium is the hair loss that your body creates either in an acute or a chronically stressful situation, either in a severe illness like COVID, or even when we give birth after pregnancy, when our body's hormones have created extra hair growth because everything's grow. Once the baby is delivered or the pregnancy ends, all that extra hair growth signal switches off, and the hair that was being grown has no longer has support. And all of the body's energy has been diverted to either heal from the illness or deal with stress. And the hair growth signals to the hair follicles kind of get lost because it becomes less of a priority for our bodies biologically. And a lot of hair can start to shed. If it's an acute illness that we recover from, usually it takes about 4 to 6 months, and the hair will get back into a growth cycle and return. But it can take a long time and be scary. If the stressor keeps going on 6 months, 8 months, a year, 18 months, the telogen effluvium, telogen is that growth phase where the hair is falling out. Effluvium is some kind of Latin root for a water flow, or probably like a flood. The telogen effluvium becomes chronic, and the hair will be shedding more than it's growing, and that is when people start to notice. There's no magical way to fix that except trying to address the stressor and potentially some hair growth and potentially hormonal treatments that can try to get in the way of the stress that's creating it. But if that stress is continuing on, if it's chronic illness or chronic family stress, the body will still want to divert energy resources elsewhere away from growing the hair. I forgot what the original question was. I know.
Yeah,
the lavender in the coconut oil.
And rosemary
And rosemary. I don't know about lavender and rosemary specifically helping hair. I can't remember right now. That is one thing I may have to come back with, but I know for sure there's an oil that definitely is proven to help grow hair, and that is pumpkin seed oil. So if you want to do an oil, get some pumpkin seed oil and eat pumpkin seeds every day. That is proven to support hair growth.
Wow, that's great to know. Sharon wants to know if you have an office in New York City and if you're taking patients.
I do have an office in New York City, and I'm taking patients. I would love to see anybody who wants to come in for some help.
Thank you. You know, Maria says she has a $30 gift card from Ulta. Is there something she can buy that can tighten her face pores? I was suggesting makeup artists to Gina. You know, if it's a visual thing and there's nothing to fix it, if it's genetic, sometimes a good makeup artist can help.
There are pore minimizing moisturizers that a lot of them are rice protein based. They're a little bit kind of drying, and they shrink the pores, the appearance of the pores. And the retinoids, you know, like a retinol. But I don't know what's cost $30 at Ulta. I would definitely go in and ask the people that work there. They are up on all of the products that they have, and they'll be able to give you a few options.
Okay. Anita says, I wish Dr. Krant was my dermatologist. My doctor prescribes cortisone ointment for everything. And now I have a chronic condition called perioral dermatitis. Perioral dermatitis?
Perioral dermatitis is a complex and sneaky rash that can form around the mouth. We call it perioral when it's around the mouth. But the overall family of these conditions is called periorificial, because it can happen around any orifice. It happens around the eyes, it can happen around the nose, and it is tricky. It can be a mixed bag that can respond to different treatments for different people. So I know that is a stubborn and tricky one. Sometimes people keep getting it because they may actually be allergic to an ingredient in their toothpaste or their lip balm. So I agree. I would not love to continually treat it with steroids necessarily, but there are some anti-inflammatory creams that are not steroid. We sometimes do resort to those for a while until we can figure out what the trigger is.
Great, thank you. So Maria's making a comment. I think caffeine and sugar age the face, and I'm curious, is that true? And what about alcohol? We know smoking is not great for healthy skin.
I'm sorry to say, everybody, that sugar and alcohol definitely trigger skin aging, and caffeine probably does in excess. A little bit of caffeine each day is not terrible, and even some skin creams contain caffeine because they temporarily, it shrinks the blood vessels in the area and can reduce puffiness or darkness under the eyes. Some people, I don't know if they are doing this a lot anymore, but some of the creams that they used to try to sell to smooth cellulite on the thighs actually contained caffeine and forms of caffeine, because it would kind of dehydrate this skin, the tissue right under the skin, and make it flatten down a little bit temporarily. So caffeine is our enemy and our friend. Coffee and tea have been proven to be a little bit antioxidant and healthy for us. I mean, tea especially, but even coffee is also antioxidant. So I'm not against caffeine and coffee. I know a lot of people who are plant-based or very, very working on being very healthy believe that caffeine is not good for them. It is an addictive drug. So to each his or her own on the caffeine. Now, what was the other part of that question? Alcohol and sugar. Sugar creates
inflammaging, right? Inflammaging. That's
yes, inflammatory aging. Sugar and even actually food cooked in high heat, especially animal food, creates a molecule that's called an advanced glycation end product, which is damaging to our collagen and our elastin. It actually sticks the fibers together in the wrong way and causes them to break. So we lose our elasticity, our juiciness, and our glow if we eat a lot of processed sugar, junk food, and alcohol. Alcohol does similar. Alcohol also dehydrates us, and alcohol damages our sleep quality, and poor sleep quality triggers aging also for other reasons, which one day we'll definitely get into.
Great. Well, we're almost out of time, but I'll take one more question from the chat from Lynn. What can you put on pustular psoriasis on the feet that is a natural product?
Pustular psoriasis is very, very stubborn and painful and, very deep-seated. I don't know of anything that's natural that is really anti-inflammatory enough to fix it. But anything that's soothing, cocoa butter, Vaseline, some of the thicker foot and hand creams, anything that's moisturizing will help to reduce some of the inflammation. I'm trying to think, there's also some seed butters that can be anti-inflammatory, but it's possible that depending on certain forms of psoriasis, can be amenable also to some changes in lifestyle. Smoking and carrying excess weight. If somebody is is what they medically would call obese, or eating sugar, inflammatory foods, junk foods, processed foods, drinking alcohol, all of those things flare up psoriasis. So really converting to 100% whole food, plant diet with a wide variety of fruits and vegetables and nuts and seeds, healthy fats, and allowing the gut microbiome to get balanced and become very anti-inflammatory may help to soothe and reduce some of the psoriasis from within.
Great, thank you. Should we sneak in one more or say
Sure.
goodbye? Okay, because I never know how long it's going to be. So Jay says, what does Dr. Krant think of nystatin powder as a treatment for suspected yeast infection under the breast? Can the suspicion be resolved by a biopsy?
A yeast infection would be able to be resolved with a superficial test, like a culture, a swab of a Q-tip. If there's truly yeast there, swabbing it, even if there's not a frank pustule, which is like a little white tipped bubble, swabbing the area of the skin should grow yeast if it's really there. Nystatin powder is directly kills yeast. And if the area is moist, it's really valuable to have a powder form that helps dry the skin out. Nystatin powder may go far to treat and clear up and dry out yeast under the breast, which could form because it likes a moist skin fold area. But if a culture is done and there is no yeast, it may be something else. It actually could be a form of psoriasis, which is an inflammatory skin condition. But when I say just, I mean not an infection. Psoriasis can called inverse psoriasis, where it would normally form on the outside of feet, hands, or elbows or knees. Inverse psoriasis is another form of an autoimmune inflammatory skin condition that forms under the armpits, under the breast, and in skin folds. It can be very red and painful, and it can look like infections, but not respond to the treatment for those infections. So keep an open mind. If the culture swab does not show yeast and other tests don't show infection and it's not responding, a little skin biopsy is not a bad idea because it could be an inflammatory process coming from inside.
Great. Well, this has been fabulous. I feel like I'm going to medical school when I talk to you. And guys, I know we couldn't get to all the questions in the chat, but you got to learn to send them in. Simply respond to the email we send you on Saturday and tell us which doctor is for. You are fabulous. I can't wait for your book or even a guide to what products you recommend, you know? I mean, especially if you're not selling them, nobody could say that you have an affiliation. You know what I mean?
Right. I definitely... Right now, I'm not affiliated with any products. And if I come up with a list of my favorites, I will for sure share it with you, Chef AJ. And like I said, I love these questions because it helps me know what everyone's interested in. And if there's something I don't know the answer to, it helps me learn too. So thank you, everyone. And thank you, Chef AJ, for having me.
Thank you for being a regular. Dr. Krant will be here the first Thursday of every month, talking about everything from the top of your head to the tip of your toes, as long as it's on the skin, the hair, or the nails. Thank you, and Happy New Year to you and your family, Dr. Krant.
All right. Thanks, Chef AJ.
Thank you. And thanks all of you for watching another episode of Chef AJ Live. Tomorrow we have another fabulous plant-based doctor, Dr. Nikki Davis. Get